Hi, my name is Patrice Johnson, and I am the Director of Partner Success for Medication Management Partners. I'm a pharmacist, and I am really passionate about helping you to make an educated decision about receiving the COVID-19 vaccine. So in today's presentation, we're going to talk about basics of our immune system, how vaccines work, key vaccines for seniors, important considerations, what to expect when receiving a vaccine, and some information about the COVID-19 vaccines that are quickly coming to market. So before we talk about vaccines, I think it's important to set a foundation of understanding about our immune system and what viruses are and how they work. So first, let's start out with a pathogen. A pathogen is any organism that can produce disease. Sometimes pathogens are bacterial, sometimes they're viral. And so here in this picture, I've shown this little cartoon, Dear Mom, I Finally Went Viral. And it's a depiction of what a virus might look like. So one of the things I want to bring your attention to is the shape of the virus. So notice how it's got these little arms. It's also got a spherical shape. And then inside that sphere, it's got some information. The information that's inside that sphere is like a recipe or a code. And so the way that viruses work is they actually attach to your cells. Your cells are like host, and it attaches to your cell and sends information into your cell to help it to replicate. Viruses can't just replicate on their own. They need your cells to do that. And so the way that they attach to your cells is really interesting. Those arms or tentacles, think of them like your fingers when you go to a door and you turn the doorknob or you put your key into the lock. Viruses literally attach to the locks of our cells and kind of turn that lock or turn that key to send its information into our cells to make more of the virus. So what's really interesting about that is that it's literally like that virus will come into our cells and use, our stove and our blender to make more of it, right? Like it's literally using our cells to make more of the virus. So when we think about our immune system and how our immune system works to protect us, we've got a couple of lines of defense. The first line of defense is our barriers. And so think of these as physical barriers to germs and viruses. The biggest one is our skin. That is, not only does our skin protect us physically from all of the bacteria and viruses that are out there, it also has some enzymes on it to literally combat different bacteria and viruses. Mucous membranes also do the same. They're, in our mucous membranes, it helps to fight off having any foreign substances get into our cells. Clotting mechanisms are another way. So if you think about getting a cut on your foot or on your arm, what happens is your clotting mechanisms kick in. They send blood cells to that skin tear or that, that tear in your skin, that cut, and clot so that it closes the skin up over that cut so that you don't get infected. Another part of our defenses is what happens if something does enter the body. So if you think about you breathe in some smoke, your respiratory system has these cilia hair-like particles that will literally push that foreign object out of your lungs, and what you experience is a cough. Our digestive system has all of this good bacteria that will outweigh the bad bacteria to get that out of your system. So we've got all these defenses right there. But then if we have something that actually gets into our cells, like a virus, that's where our immune system really kicks in. Our red blood cells will come to the area to bring more blood and oxygen to the area. What also will happen is we will mount an inflammatory response, and that's really geared to almost section off where that infection is. And then our white blood cells, macrophages, B lymphocytes, or what you might hear of as B cells, T lymphocytes, they then do their work. And so let's talk about them. So macrophages are white blood cells that literally swallow up or digest germs. They also digest dying cells, cells that are damaged. And so all throughout our bodies, macrophages are literally going through the body and kind of cleaning up. They're cleaning up, think of it like cleaning up the kitchen. So it's really cool how they work. They remind me of Pac-Man, of that arcade game Pac-Man. When macrophages do that, they will leave a little piece of the virus called an antigen. And I'm going to explain what antigens are in just a minute. We also have B lymphocytes that will produce antibodies that will attack those antigens left behind by the macrophages. And T lymphocytes are defensive white blood cells that will also look to see where have cells already been infected with the virus, and then they'll go back and treat whatever's already been infected. They will also remember how they address this so that in the future, if you're ever attacked by that type of virus again, it knows what to do. So again, let's talk about antigens. So an antigen is found on the surface of a pathogen. Remember, a germ or any sort of thing that causes the disease. The antigen, when it enters the body, as I said, the macrophages are working to digest that virus, and they might leave this little piece of that virus so that your antibodies can attack them. Now, one of the things that's really important about antigens is that the antigen could be a piece of that spherical cell that I showed you earlier. It could be that finger-like part of the virus. It could be even a piece of that. What's key there is your body will recognize them as one, foreign and also harmful. And when it recognizes them as harmful and foreign, our B lymphocytes will produce antibodies to attack them. So if you think about, again, those little fingers on the outside of that cell of a virus, what happens is those antibodies kind of inactivate those fingers. So if you think about the fingers being used to pick that lock, that doorway, that doorknob that gets into your cells, the antibodies literally will inactivate those fingers or inactivate that antigen so that it can no longer get into your cells. It's really cool how our body does that. Now, the very first time that you're exposed to a virus, it's going to take a couple of days for your body to create these antibodies to attack those antigens. And by attacking those antigens, which are on the outer part of that virus, they're going to keep that virus from connecting with your cells and causing an infection. Once you've had that initial interaction with the virus and your body creates those antibodies, then after that, if you're exposed again, your body's going to remember and have antibodies to be able to address it. So the reason that we call vaccines our best defense is because they literally contain like a weakened or an inactivated version of the antigen that will cause the disease, and they imitate a real infection. By imitating the infection, not causing the infection, it allows our body to build that response and address it without making you sick. So let's talk about the different types of vaccines that are out there. And, again, we're going to be talking about the COVID vaccine in a minute, but I wanted to first talk about some of the vaccines that are already out there to help you understand how all these vaccines work and how we expect the COVID-19 vaccine to work as well. So first, with weakened viruses, you might hear them called attenuated viruses, live viruses, or weakened viruses. The word is vaccines. You may hear them called weakened vaccines, live vaccines, or attenuated vaccines. These are things like measles, mumps, rubella, that vaccine, the smallpox vaccine, chickenpox vaccine, or the yellow fever vaccine. And in those cases, what's happened is we've taken the antigen, we've taken a piece of that virus. Now remember, it's not the virus, it's just a piece of it that wouldn't cause the infection, but it would cause the body to mount a reaction. We've taken that piece and we've really dwindled it down. We've literally If you think about, the way I compare it is to a copy machine. If you take a sheet of paper that has really dark print and you put it on an old copy machine or a copy machine that doesn't have much toner left in it, as you make copies, those copies get lighter and lighter and lighter. It's still a sheet of paper, but you can hardly read what's on there after about the 1,000th copy. When we create a weakened vaccine, what we've done is we've literally gone through what's called a passaging process, where we've weakened the virility of the virus, so it can't cause the infection anymore, but your body can still recognize the cell to build those antibodies to lock up those fingers so it can't break the lock into your host cells. When we talk about inactivated vaccines are one where we've taken that antigen and we've isolated it and we've treated it with heat or with a chemical and then purified it so that the cell still looks the same. It still has, that sphere shape. It still has those tentacles. It still has, the same look, but yet it can't cause you to be sick. It can't cause you to get the virus. But what it can do is still imitate it because the shape looks the same. And so influenza vaccine, rabies, polio, all of those are vaccines that are using an inactivated version of the virus. Again, cannot cause you to be sick, but can at least trick the body to recognize what the cell looks like so that if in the future it gets exposed to that particular virus, it knows what to do. Then there's subunit or conjugate vaccines. So that would include the hepatitis B vaccine, whooping cough, shingles, human papillomavirus vaccine, and the pneumonia vaccines. These take a little piece off of that sphere, off of, maybe the protein coating of a virus. And again, they take that. Again, it's not the virus. Again, it's not the code. It's not the part that will make you sick. It's simply helping your body to recognize the cell. So they take that part, replicate it, and actually use that to make the vaccine so that your body will, again, recognize the antigen, create antibodies for it, and so on. The last type of vaccines that have been very common up until now are diphtheria and tetanus. And those are toxoid vaccines. What's unique about toxoid vaccines is that they literally look for what is the part of the virus that causes the problems. Like, what is the most harmful part of that virus that causes the issue? And then let's figure out how to combat that. And so they take that, the part that's the challenge, and then they inactivate that part. But because the cell still looks the same, they use that as an antigen for the vaccine, so that, again, your body will be able to make antibodies for it. So again, as I've talked about before, the way the vaccines work is they're like pathogen imposters. A vaccine will program your immune system to remember a particular disease by allowing it to practice on a weakened or inactivated version of that pathogen. This is considered the primary response. Then if later that pathogen invades the body again at full strength, the immune system is ready and will have a swift and very specific defense because it knows exactly how to treat that pathogen. And that's called the secondary response. Primary response and secondary response are super important, especially when we're looking at the COVID-19 vaccines. The vaccines that are coming to market first are two-step vaccines, meaning that they require a first dose and then a second dose 21 or 28 days later. The reason for this is we found that primary response, although it helps to build antibodies, it's not building enough and causing enough of a reaction so that we know we can protect you from the serious illnesses that come with getting COVID-19. And so having that second dose is going to have you build more antibodies and have a better response if in the future you're ever exposed to COVID-19. So I want to take a moment to talk about how vaccines are made. And I think this is important because one of the common questions about the COVID vaccine is, like, how did they pull this off so fast? So one of the things that you should know is that when vaccines are being created, the first thing to do is identify the antigen. So what's going to be the part of that virus that you're actually going to use for the body to recognize it? Is it going to be the spike or the fingers? Is it going to be the cell wall? Is it going to be some small part, of that cell wall? What is it going to be that's going to be recognized to the body as harmful and foreign, but yet not give the body the disease? So the first thing is to generate the antigen. And when talking about like the flu vaccine, I'll use that as an example. When they make the flu vaccine, what they do is they identify the antigen, and they actually use chicken eggs to grow it. And so it takes quite a long process to create flu vaccine, because they've got to take fertilized chicken eggs, then inject it with the antigen, and then grow it over time. And they've got to spend a lot of time purifying it. So when you compare it to the vaccine that most people are familiar with, which is a flu vaccine, the time it takes to create a flu vaccine is dramatically longer, because you're using a process of animal cultures to create it. Whereas with mRNA vaccines, which is what we're going to use with COVID-19, you don't need to use those types of media, and you don't have to go through all of those additional processes. So generating the antigen is a lot faster. Then isolating it, purifying it is a lot quicker, and then making it strong enough to be stable in the bottle and be able to be distributed is a lot easier. So when it comes to vaccines, there's a few key regulatory agencies that oversee the process. So the Food and Drug Administration, of course, approves vaccines based on the safety and efficacy for that particular indication or for that particular use. The Advisory Committee on Immunization Practices, they actually provide recommendations on who gets the vaccine and when they should get the vaccine. One of the common things that happen is we think of vaccinations as stuff that you got when you were kids, but there's a lot of vaccines that we actually should continue to get in our adult lives, because immunity does tend to waver as we get older. The ACIP actually works with being very specific on, what areas are these viruses a challenge, who should get the vaccines, when they should get them, how often they should get them. And then the Center for Disease Control and Prevention, they actually approve ACIP recommendations, and then they publish that information and a lot of helpful information about the disease on their website. So if you haven't gone to the CDC website, it is very easy to use. It's cdc.gov, and you'll find a wealth of information about really any disease that you want to look up. So as I said earlier, immunity does not always last forever. Immunity is created by some vaccines, but it doesn't last, the entire time of your life. So for instance, the flu vaccine, it's one that we have to get every year, because those antibodies don't last longer than, a season of flu. And so that's why we actually give the flu vaccine around, between August and November to prepare you for flu season. And then every year we do that. What we've learned with adults is that as we grow older, those parts of the body like our thymus and our bone marrow that actually make those T cells and B cells, or T lymphocytes and B lymphocytes and macrophages, as we grow older, the quality of those B cells, T cells, and macrophages isn't as strong as what we had when we were younger, and therefore that immunity or that immune response isn't as strong as we get older. So key vaccines for really any adult is the yearly flu vaccine. If you're over 65, the high dose vaccine is incredibly important. For shingles, because anyone over 50 is at a high risk for shingles. Even if you've actually had it before, you're at a high risk for getting it again. The shingles vaccine is also important, and it requires 2 doses. And then the pneumococcal vaccines are very important as well. So why are vaccines so important? And just using flu vaccine, again, I'm using this as an example because flu vaccine is so well recognized. One thing I want you to know is the flu vaccine in a typical flu season is about 40 to 60% effective. But even if half of all of Americans get the flu vaccine, that saves 3,500 people from dying. And so to just look at what's saved by getting a vaccine that's even, between 40 to 60% effective, that's really tremendous. And with these new COVID vaccines, both of them are over, the Moderna and the Pfizer vaccine are over 94% effective. So you can imagine what a dent that's going to put in this incredible mortality number that we're seeing in the news. So I included this slide to just share that with typical vaccines, there is going to be some soreness or redness in the area where the injection was given. It's likely to have a low-grade fever within the first day or so of the vaccine. There's also a possibility of having some muscle aches. Usually these symptoms dissipate within a day or two. On rare occasions, someone could have an allergic reaction, but again, that is rare. So one of the things that often comes up when people are talking about vaccines is they'll say, oh my gosh, I got the flu when I got the flu vaccine, or, the vaccine made me sick. And a couple of things I want you to understand about that. One is the vaccines, whenever you receive a vaccine, it is not instant immunity. Remember, a vaccine is actually giving you the antigen so that your body can recognize the antigen, recognize it as harmful, and recognize it as foreign, and then it's going to build the antibodies or make the antibodies to address it. Therefore, it may take a couple of weeks for you to actually build that immunity. And so in that first day, first 24 hours to 48 hours of receiving a vaccine, yes, you might notice a reaction because your body is doing exactly what it's supposed to do. It's recognizing that there's a foreign substance, and then it's going to come after it with all the power of our immune system. Now, while you're building that immunity against the flu or against whatever you've been vaccinated against, you are still at risk for getting the flu or getting, whatever the disease you're being vaccinated against. And so you really want to wait the full period of time to allow for that immunity. So in the case of flu vaccine, it's 14 days. In the case of the COVID vaccines, there are 2-dose vaccines, which will require at least 7 to 14 days after receiving those 2 doses to truly have immunity. So it will be really, really important to have both of those doses before you can consider yourself immune. And again, it's 7 to 14 days after having both of those doses. So there are some considerations with receiving any vaccine: allergies, medical history, immunization history, current condition, what's available, which product is available, and cost, which is usually covered by insurance. One thing I'll say when it comes to allergies is, although allergies to vaccines are rare, there are some people that do have an unexpected reaction to vaccines. And for that reason, as part of any immunizer's protocol, they always carry EpiPens with them in case someone has an unexpected anaphylactic reaction to a vaccine. And so that's part of every protocol, whether you're getting just a flu shot or a Shingrix shot or even the COVID-19 vaccine. All right, so now that you understand how our immune system works and how vaccines are made, let's talk about the COVID-19 vaccine. About 8-9 months ago, there were over 140 vaccines being researched to see if they would be viable candidates to come to market. Right now, we've got a little over 60 that are in different phases, and we've got 2 that are very close to being approved. In fact, at the time that I'm taping this, it's likely that the Pfizer vaccine may be approved literally tomorrow. As I shared earlier, both of the vaccines that are coming to market probably, in the next couple of days, require 2 doses or 2 shots, 21 to 28 days apart. There are some options being studied that would only require 1 shot, but those are not finished with their testing, so we don't have all the data on those. The trials have repeatedly proven that each of these vaccines, both the Pfizer vaccine and the Moderna vaccine, are safe and effective, over 94%. The Pfizer vaccine, for instance, is 95% in the general public, 94% in people over 65. We know that, for instance, with the Pfizer vaccine, roughly 7 days after that second step, that's when immunity is created. What we're not sure of yet is how long the antibodies will last. And the reason we're not sure of that is because we're literally in the first year of dealing with this disease. In the past, we've had far more years to develop a vaccine and far more data. In the case of the COVID vaccines, the process has been expedited, but no steps have been taken out. What that means is that we were able to get a vaccine to market pretty quickly, but there are some things that we just don't know because literally the disease isn't old enough, right? So if someone had COVID earlier this year, we're still recommending that they get the COVID vaccine because we just don't know how long those antibodies will last. So I believe that it will be likely that the COVID vaccine will be something very similar to the way we do the flu vaccine, where at least yearly you're getting that dose. So just to reiterate, the process for approving a vaccine, it's a pretty lengthy process. So both the Pfizer vaccine and the Moderna vaccine have gone all the way through to pass this phase 3, and they're right in this approval and licensure part. Now, you may be wondering, what's the difference in FDA actually approving a drug versus FDA doing an emergency use authorization? Emergency use authorizations are something that is invoked when there is a public health emergency, which is absolutely what we're in. With having so many deaths related to COVID-19, it is absolutely vital that we get this vaccine into the hands of the public as quickly as possible. It does not mean that any steps were skipped. It means that all of these steps were moved to the front of the line, right? So if you think about a fast pass at Disney World, getting to the front of the line for the roller coaster, all of these things were given plenty of money to do all the studies that were needed. The information was high priority, and the studies were easily able to get a lot of participants because there was so much visibility as to what was going on with COVID-19. So these phase 3 studies had 25, 30, 40,000 people in them, as opposed to, just say 10,000. And so again, you can be rest assured that first of all, these products were deemed safe two phases ago. In terms of the trials, as I shared, there were several thousand people enrolled in the trials. One of the things that is really important to also share is that there was a diversity amongst the participants of the trials. So about 30% of the Pfizer trials were diverse, 10% African Americans, 13% Hispanic. The Moderna trial, about 37% diverse. Also in these trials, both of them included people who were over 65. The other thing that's important to know about these trials is they both included diabetics. They included people with heart disease or cardiac disease. They included people with lung disease, included people with severely obese people as well. So the people who are at high risk for getting the severe versions of COVID-19, the severe disease of COVID-19, they were included in the study. And so to, again, be 95% effective in preventing serious disease from COVID-19, that's just incredible. It's incredible. So these were well-designed studies that had the right patient population to be able to tout its safety and efficacy. So in terms of the types of COVID vaccines, what I want to highlight here is that there's 3 types of vaccines that are currently being studied. The mRNA vaccines are the first ones to come to market. And the way that they work is, if you think back to what I shared earlier about how a vaccine or how a virus can attach to our cells, kind of use its fingers, its tentacles to break that lock so that it can send information into our host cell. The information that it's sending in is its own RNA to literally tell our cells how to make more of it. The way these mRNA vaccines work is they figured out how to send a message into our cells to make one small piece, to literally send a message to our cells to make a small piece of the virus which is called an antigen. These, the mRNA that is transferred in these vaccines will literally make one small piece of the virus, not the piece that would make you sick, but literally it would make that antigen or that spike protein that's on the outside of the virus. By doing that, by having our own cells make that outside coating or that outside spike of the virus, what will happen is in the future, if we get exposed to it, our bodies will recognize it. And so just want to restate that because I want to make sure you guys understand. It's not making the entire virus. It's not giving you COVID-19. All it's doing is taking one piece that's recognizable to the body and will be recognized to the body as harmful and foreign. It's teaching your host cells how to make that piece. And then what will happen is your body will make that piece. Then your body will recognize, hey, this isn't supposed to be here. And it will create antibodies for it. And then that will protect you from the disease in the future. Subunit vaccines for COVID-19 are much like subunit vaccines for any other disease like HPV or shingles. They take a small piece, a harmless piece of the offending virus, not the whole pathogen, and they use that in the vaccine. It cannot cause the disease, but it can at least help your body recognize that antigen in the future by building antibodies for it. And then a vector vaccine, and these are also still in trials, it contains a weakened version of a virus that does not cause COVID-19, but what they use this weakened version of a harmless virus to do is send in the antigen that would have COVID-19 recognizable to your host cells. And so it gives those instructions to our cells to make a protein that's unique to COVID-19 and then allows us to build those antibodies. So again, every single vaccine out there is designed to expose you to an antigen either by providing you a weakened or inactivated version of it or having your body make the antigen so that it actually can teach your body to make the antibody so that in the future, if you're ever exposed to that disease, your body knows what to do. So in terms of side effects and what to expect with the COVID-19 vaccine, these side effects that I've listed here were experienced in the trials. And the most common ones were chills, fatigue, being slightly feverish, having a headache, muscle ache, nausea, or tenderness at the injection site. These side effects are really not dramatically different than what we've seen with other vaccines. The side effects dissipate within the first 24 to 48 hours, and there were no patients in any of the trials that required hospitalization or became seriously ill from these side effects. They're more of nuisances than necessarily, being anything that really knocks you out. Again, these side effects are self-limiting, and they're a sign that your body is doing exactly what it's supposed to do. Because if you're feeling feverish, it's because your body's imitating the infection, creating those antibodies so that in the future you can fight off the disease if you're ever exposed to it. So in order to stop this pandemic, we've really got to continue to protect ourselves and others by using every tool in the shed. We've got to continue wearing masks, continue to social distance, wash our hands, use sanitizer when hand washing is not available, quarantine when required. And getting vaccinated, especially knowing that our vaccines are 95% effective in protecting us from serious illness, is the most important thing, right? So it's our best defense. So I would say in terms of next steps, if you haven't already been vaccinated against the flu, please do that. The reason I also talked about the flu in this particular presentation is because we want to decrease the risk of people getting the flu and COVID. They are two separate diseases. We want to also make sure that people are as healthy as possible. We want to have you plan to get the COVID vaccine, give consent if you are the POA or the responsible party for a loved one to be able to give consent to get the COVID vaccine, and to also, take this time now that you understand more about how vaccines work to look at, you know, have you had the pneumonia vaccine? Have you had the shingles vaccine? Are there any other vaccines that you need? So with that said, I hope that you found this presentation helpful. And if you have any questions, the first thing I would direct you to is the cdc.gov website. There's so much information on cdc.gov to help you to understand vaccines, to help you understand COVID-19, and also to help you understand how this works. Thank you very much.